First of all, you will have no pain because we manage it by painkillers. You will have some bruises, swelling on your face and nose, but it's not a big deal. You will wear a splint for 1 week. Nobody can say any technique is better than other because I think a plastic surgeon should perform both of them, and the thing is which technique is suitable for the patient. I think there is no best technique because it depends on the necessity of the patient. The open technique leaves a little scar on the base of your nose, but closed technique, incisions, is hidden inner side of the nose. I decide which technique is better for you during your personal consultation. Absolutely, if you have any problem about your breathing, for example your septum deviation or nasal valve problems, we are fixing it. There is no upper age limitation, but for the female patient 16 and for the male patient 18 years old is our lowest age limit. You will have some bruises and swelling on your face and nose. Bruising and swelling on your face will done about 1 week. Your nose swelling reduced day by day. It will take about 1 year to see final results. Any other questions? Liposuction is performed to remove the fat under your skin. The main thing is, I think it's very important, this is not a way to lose weight. It's just for give a shape to your body. All liposuction procedures are customized to each patient's needs and desired outcome. Removing 5% of your total body weight is safe, but sometimes it won't be enough. This amount can be increased according to condition of the patient. I decide that during the operation. During the first days of recovery, sometimes you can feel a light pain, but it's manageable with the painkillers. You can, and we encourage you to start walking the same day of the surgery. First, you need to wear a special medical garment during 1 month. Second, you need to make sure about your diet. It should be healthy and you need to drink enough water. You need to walk a few minutes at least per day. I also recommend lymphatic drainage massage. If we sum it up in a nutshell, you have to wear special corsets, take 1 or 2 weeks off from your work, eat healthy diets, hydrate your body, take your medications on time, avoid smoking, alcohol, blood thinning medications, and herbal supplements. And the most important thing, follow your doctor's instructions. First of all, hair transplantation is a surgical procedure. We take your follicles from your donor site, which is your nape, then we transfer them to your bald area. Follicles which are on your frontal area, they are weak, but the follicles on your donor site, they are resistant to your hormones because their structures are different. After transplantation, first washing will be made by our team and we will teach you how you take care of your hairs all through your life, because your original follicles which are located in your frontal sides, they are not resistant to your hormones, but the nape areas follicles, your donor sites, they are resistant. When we take them and put the bald area, they are already resistant. So we can say your transplantation is permanent. In 3 weeks, you're gonna lose your transplanted hairs, but your follicles will be there. Then the hair will continue to grow up, and 3 months later, you're gonna see your new hairs, and 1 year later, they will be strong, and you're gonna see the final result. No, it's not. I have good news and bad news. Good news is we are performing all kinds of surgery techniques, but any one of them doesn't give you any pain. Bad news is local anesthesia can just give you just a little pain maybe. And after we give you local anesthesia during the operation time, and then you will not have any pain. No, there is no any age limit. We can perform it any adult patient, whatever their age is. Breast augmentation is adding volume to your breast. How we are doing this? We are using silicone prosthesis or your own fat or both. If you are using both of them, we are calling it composite breast augmentation. No, you don't have to wait until you have a children, but you have to wait at least 6 months after you stop to breastfeeding. Yes, you can, because we are not touching your breast tissue. We are putting prosthesis under your breasts, but in a different region, under your muscle, or under your breast tissue, but not inner side of your breast. This is why we are not touching to your breast tissue, and this is why you can feed your baby as normal, as you don't have prosthesis. In other words, your breastfeeding potential will not change. After surgery, during first 3 days, you have to lay down on your back. And first 1 week, you cannot drive and you cannot carry anything more than 1 kg. About 6 weeks later, you can make light exercises, and 3 months later, you can make hard exercise, whatever you want. First 1 month, you have to wear a special garment, medical garment, shaped as a bra. It depends on your job. During your job, if you have to make upper arm movements, you need at least 2 or 3 weeks. But if you don't use your arms, 1 week is enough for you. It's totally subjective and it's all about your sense of beauty. During your consultation, I'm making a quiz. How? I'm showing some pictures, after and before pictures, which size of breasts you like. Because every patient who I consultate always talk to me, I want natural. What is natural for you? We need to find this question. As I told you, it's very personal, and best way to find it is making a face-to-face consultation. During our consultation, we can set obtainable and healthy expectations together. I think breast reduction is not only an aesthetic procedure. I think it's functional also. There is no any medical indication. Indication should decide by the patient. If you're not happy with your size, if you have some problems about your shoulders or skin under your breasts, it means you're a good candidate to reduction surgery. Just like other breast surgeries, you need only 1 week. You don't have to wait until you have kids, because during the surgery, we are protecting your breast tissue and midline. If you are uncomfortable with your breast, you can have your surgery. First month, you have to wear a special medical garment shaped as bra. Then second and third month, you can wear bra but without wire. 3 months later, you can wear whatever you want. Mastopexy is very similar with breast reduction. Only difference is we are not removing any tissue, we are just removing the saggy skin. And we locate your nipple to a higher location. The ideal location is between 90 to 21 cm from your sternal notch. If you have enough tissue, you don't need, but if you want bigger breasts, we are using silicone implants to provide volume. Gynecomastia is a medical condition characterized by enlarged male breasts. This can be due to fat or glands, or both. Enlargement can be caused by excess fat, glandular tissue, or both of them. No, because if you have glandular tissue, you cannot get rid of it. Maybe you can reduce excess fats by exercise, but it's not easy to do it. The only way to reverse gynecomastia is male breast reduction surgery. In most cases, the results of this surgery is permanent. Homoplasty is a general term. We can categorize this kind of surgeries for different categories. One is breast augmentation, one is mastopexy, means breast lift with or without prosthesis, one is breast reduction, and gynecomastia.